السلام عليكم ورحمة الله تعالى وبركاته، مشاهدي قنوات بي إن سبورتس أينما كنتم نحييكم. هذه ليلى سماتي ترحب بكم مجددا، أهلا بكم معنا في هذا العدد الجديد من برنامج العيادة الرياضية، سنخصصه لإصابات اليد بمختلف أنواعها. إنه عالم خاص، فتعالوا معنا لنكتشف أسراره عبر العيادة الرياضية.
I am from Sweden. I worked as a hand surgeon there for more than 20 years, and I also wrote my thesis about wrist arthroscopy and ligament injuries. But suddenly my old friend, Professor Jan Ekstrand, called me last autumn and asked if I want to come here because they needed a new hand surgeon. I was very surprised, for sure, but also very happy because I have heard about the world reputation of Aspetar.
They jump many times during the training or during the game.
How many physio sessions?
I have made a study about soccer players, and 50% of the injuries for the goalkeepers. They often suffer from ligament injuries in the wrist, but also thumb fractures and dislocated fingers. And of course it's difficult for the goalkeeper. It takes time, layoff time before he can join the team again. Same injuries in outfield players, they can almost play at the same day. So it's a huge difference for them. Volleyball, yes, often finger injuries. Dislocations, handball also, but they're mainly shoulder injuries because they get blocked, and for sure also knee injuries. Hockey player, they have a special injury at the ulnar side of the wrist when they go into the wall with rotation. It's actually called the hockey wrist. And then we have lots of instability in the wrist among tennis players and table tennis players, more like overuse injuries. So I treated the world champion from China here. So it's very nice to work here because we gain patients from all over the world because of the reputation. So I'm proud of that.
معصم اليد من أكثر المفاصل عرضة للإصابة على مستوى الأربطة والأوتار في حال أي حركة خاطئة، وحتى الإجهاد يؤدي للإصابة.
It's actually metacarpal fractures and fractures all over. The second thing is ligament injuries to the thumb, very common, and mallet fingers with axial load to the tip of the finger, very common. And it's difficult to treat because they have to have a custom-made splint for 6 weeks. It's difficult for a professional. And then we have the scaphoid fracture, dorsal impact. And this is hard to treat because it takes almost 3 months for healing, so it's difficult for the players. And then for sure the forearm, and don't forget the elbow. We have had severe injuries with the dislocations of the elbow. And for sure after the career they suffer from degenerative arthritis and pain, but they don't think about that when they are 20. So sometimes we have to fix them after the career. And also maybe I wait to in between seasons or after the career if they have a severe injury in the wrist. There I know that after the operation it takes almost 6 months for recovery. Then we can put it in between the seasons or maybe after. So treating the athletics, you have to think in another way. Because it's not only about the injury, it's their income and also the necessary for the club. So you have to have a wider perspective treating those guys and dolls.
إصابات المرفق تتباين خطورتها، لكنها في العموم تتطلب التدخل السريع وعدم التهاون، لأن ذلك يؤدي إلى تأزم الوضع ويحول دون الوصول إلى نتيجة إيجابية تعيد الرياضي إلى سابق مستواه. تختلف طرق العلاج حسب نوع كل إصابة.
Ligament injuries, we have three very important ligament injuries. One of them, the scaphoid ligament injury, if we don't treat it in 6 weeks, it's not possible to treat. And often they get problems afterwards. And if you misdiagnose them, which is very common because the MRI is not sufficient, we only catch 40% of the injuries. Arthroscopy is still the gold standard of diagnostics. So I use it for diagnostics, but at the same time I repair those ligament injuries, so we don't, so we get as good result as possible. So when I use the arthroscopy, I use like 2.4 millimeter small instrument. I have to watch on the TV, and then I have the working tools on the other side, like a grasper and a small shaver. And I can also put sutures inside there, so it's quite delicate. But it's much better results in terms of comparing with open surgery. Not so big scars for sure, so the cosmetics for the ladies is important. And you see the injuries much better. The stiffness is more or less than in open surgery, so I prefer to do that, but of course it takes a couple of years before you know how to use this tool. It's not for beginners.
إصابات أصابع اليد، الخنصر، المنصر، الوسطى، السبابة تتعدد صورها بين خلع في المفصل الوسط، وقد تحدث في مفاصل أخرى للأصابع. عادة ما تحدث عندما يكون الإصبع منحنيا للخلف، وقد تحدث عندما ترتطم الأصابع بالكرة خلال ممارسة كرة السلة، الكرة الطائرة تحديدا. وفي مشهد آخر قد تتمزق الأربطة التي تربط عظام الأصابع مع بعضها البعض.
This joint, the pip joint, and it's the worst injury in the hand because it causes so much stiffness. So you have to practice for 3 months. They can have flexor tendon injuries. So I have to operate with a big incision to reinsert a flexor tendon, and then they need 3 months of recovery because if they go with a cast like this, the finger will be stiff. And sometimes if we have open injuries, they can have nerve injuries. Then I need to use very big loops to see the nerve because it's only 1 to 2 millimeters, and I suture them with a thin thread. They will get better and better sensation, but it often takes 3 months as well. But only children and youngsters get totally recovery of the nerve injuries because the nerve or the kind of tissue that heals most badly in the body actually. So nerve injuries are difficult to treat in a good manner.
إصابات اليد وآلام الأربطة على مستوى المرفق تشيع في رياضات عدة، بينها كرة القدم. عادة ما تشكل هذه الإصابات مشاكل وآلام مزمنة وطويلة الأمد، تحدث أيضا بطريقة منفصلة خلال حركات سريعة أو أداء فني على المستطيل الأخضر. يتم علاج هذه الإصابات بمختلف درجاتها باللجوء إلى التقنيات الجراحية المختلفة، لكن مع التشديد على الخضوع لفترة إعادة تأهيل بعد الجراحة تستغرق فترة تتراوح من 3 إلى 4 أسابيع، وقد يصل الأمر إلى قضاء حوالي 4 أشهر حتى يستعيد الرياضي حركته الطبيعية.
Dislocations of the elbow is very difficult because they get stiffness afterwards. They can have also overuse injuries with nerve compression. So sometimes I need to go and decompress the nerves. That's a quick recovery after that, and they get stronger in the hand. So there are many issues in the elbow also, for sure. I examined Professor Popovic here. He is an old handball player. He received the gold medal in Munich Olympic Games in 1972, and he had a elbow dislocation. And still, he can only go from 30 degrees up to 90. But he told me, life is perfect, so he didn't complain about that, and I think he has had a golden life without hand surgery. Because the most important that I try to teach the fellows here is you must learn which patient you are not supposed to operate on, because they are here.
في اليد تجتمع مفاصل العظام الأكثر هشاشة في جسم الإنسان، لذلك نرى الملاكم قبل كل نزال يلف يديه في منطقة الكف حتى حدود المعصم لكي يحمي مفاصل الأصابع وظاهر الكف من الإصابة. عملية اللف ليست عشوائية، بل هي مهمة رئيسية يختص بها أهلها.
The boxers often get an injury here with a fracture intra-articular that we have to fix. And they will have to wait almost 4 months. Of course, with specific protection they can train quite fast, but in a real match they will have to wait. So not stronger, weaker, I would say. But it's, we have a lot of myths in the society about things that doesn't cope with my mind. So if they believe they get stronger, it's okay. But I would never break a finger by occasion. No, it's in my mind it's wrong.
كثرة التمارين لا يعني بالضرورة الوقاية من الإصابة، لذلك يقوم الملاكم بلف يديه بعناية شديدة بهدف حمايتها من أي نوع من الإصابة، بالإضافة إلى تقنيات أخرى من الضرورة أن يقترب منها لكي يحمي يده من الإصابة.
Actually, exercise and training of range of motion is very important. If you don't do that, then you can have arthritis. And sometimes you can avoid surgeries if you know how to train the muscles, because the muscles are part of the stability. 1/3 of the stability is counted by the muscles. So for example, with ligament injuries in the wrist, you can close the fist and extra on the little fingers, you put strength on one of the tendons. In 1/3 of the cases, then I don't need to do the surgery. So I often wait the 3 months. If it's an ordinary patient, in athletes, they often require earlier surgery, but it's very important to have good contact with rehab and with the hand therapist. And I have a very good cooperation with Omar Kher and Nicoletta here. So we are a strong team. So I like to work here.
وهذه إمكانية التسويب، التسويب رائع، علي مبغوط وساد الشيب، حديد في حديد.
the goalkeeper of Qatar national team get injured 2 weeks before the World Tournament. That would be a catastrophe. But in terms of specific injuries, is nerve injuries, elbow luxation and disc joint. Because it's so small structures, it's difficult to operate in the correct way, and often if they arrive like 2 weeks too late, the structure is not possible to suture. So that I think is most difficult. And of course, big trauma, high energy trauma with the smashed wrist, very difficult. 30% of them receive degenerative arthritis, and 50% of them can't go back to high-level sports.
الدكتور جوني أندرسون خبرة سويدية تعدت شهرتها الحدود المحلية لتصل إلى العالمية. اسم له وزنه في الطب الرياضي عموما وعلاج إصابات اليد على وجه الخصوص. أندرسون انضم إلى السبيطار ليضع خبرته تحت تصرف المستشفى الرائد، المستشفى الذي لا يكتفي بتوفير العلاج للمصابين بل يسعى دائما لتكثيف جهود البحث حتى يصل إلى حلول للمشاكل المستعصية التي تحول دون مواصلة الرياضي لمشواره الرياضي. الإصابات التي يتعرض لها السبيطار دائما لديه الحلول لذلك.
Nowadays I'm the director of research for the surgical department, and I produce a couple of articles about athletes and hand injuries. And working at Aspetar feels to be in a family. We have a very good head of research, Marco Cardinale, that we speak a lot with and come up with different projects. And the last thing, I think it's very important to work together with the other departments, physiotherapy, sports medicine, and also the radiology department. So then I think we could have a conjoined strengthening of Aspetar. And then we must have the profile in hand surgeries, wrist arthroscopy. And actually I'm the only hand surgeon in Qatar. So I have a difficult job. Sometimes they call me from Muhammad University to discuss patients, and we bring them here because they are not used to treat them. And I always have one fellow following me here if he's interested in hand surgery. So, my future perspective, I would like to educate one Qatar hand surgeon. So when I leave, I can be proud that Qatar has an own hand surgeon. That's one of the missions.
الدكتور جوني أندرسون طبيب جراح باحث أكاديمي، وجد في سبيطار الجو الملائم والأسرة التي تقوده نحو تحقيق المزيد من التميز والتألق. جوني أندرسون وجد في سبيطار الفريق المتكامل والخبرة في مختلف الاختصاصات بهدف الوصول إلى الريادة إلى مكانة على خريطة الطب الرياضي العالمي.
Actually, we don't know that, but I'm into that research together with Professor Jan Ekstrand and Professor Jon Karlsson. There are some issues that we can try during pre-season for the goalkeepers. They can train the stability, and maybe we can avoid some wrist injuries. They can also, because one common injury is intra-articular Bennett fracture here, and then they can train two muscles to strengthen the ligaments here. Those two things I think can prevent difficult injuries. And of course, contact with hand therapy after an injury to prevent re-injury. It's also important. And for the goalkeepers to prevent overuse. He should, or she should not make the same range of motion all time. We have to change the training and don't overuse the sensitive wrist and hand. So there are those three things I think is very important. So.
The training before
Yeah, pre-season.
Before starting training,
Yeah.
they must prepare.
Yeah,
where
and-
they have,
Yeah, for sure, and also nutrition and sleeping, having a mentally good condition is also important. So there are lots of things, and it's stimulating for the future, of course. I was a team physician in Gothenburg, and I like to work with the athletes. But it's also sometimes like a snowball. If you start with athletes, then you have to treat his girlfriend and his wife maybe, and then the whole family, grandfather, and so it's a huge effort to be a team physician sometimes. Yeah, now I'm happy. I can play golf 4 times a week. I even go to swim in the sea. And of course, in Sweden you can easily become depressed because we have darkness for 6 months. Here is always the sun shining. So I like the country and the people. Yeah, so I'm satisfied with my life at the moment.